Hello everyone, welcome back to TekXpresso, where we serve quick, insightful, and engaging technical lessons. I'm your host Veer Varma, and today I'm excited to be speaking with Dr. Akash Parvatikar, an AI scientist and product leader working at the forefront of digital pathology and precision medicine. Dr. Parvatikar specializes in turning complex histopathology data into actionable insight that accelerates cancer diagnostics. With a PhD in computational biology from the joint Carnegie Mellon University and University of Pittsburgh School of Medicine program, he brings deep expertise in computer vision, machine learning, and explainable AI in healthcare. He currently leads a pathology map platform at HistoWiz, where he's building AI-driven tools that enhance diagnostic workflows and brings greater transparency and trust into cancer care. Let's get right to it.
Hello, everyone. I'm here today with Akash, and in this episode, we'll be talking about three big ideas: how AI is transforming healthcare, what AI diagnostics and what it truly means in practice, and how AI-driven pathology and precision medicine could shape the future of patient care. So, thank you very much, Akash, for coming, and let's get started.
Firstly, thank you so much, Veer, for inviting me on your podcast. Super excited. I've seen some of your previous episodes, and it's very engaging and interesting to a wider audience who don't have domain expertise. So excited to be on here, and we can get started.
Thank you very much. Yes. So, Akash, my first question for you was, AI is showing up in everywhere, like in many different fields, whether it's from our phones, to like classrooms in schools. So, in one area that many people don't hear about AI is in healthcare. So, my question for you is, in healthcare, it has the potential to like actually, save lives. So, which areas of healthcare do you think AI will actually transform the most, and how might this actually change the way we actually experience care as patients?
Yeah. So I think that's a broad question, and very interesting and important. And healthcare involves like several different things, right? From patient management to clinical reports to and when you go towards the biotech side of things, it's like drug discovery. So AI has put its place in each of these individual domains, and each of the domains are making significant progress with the help of AI. And I think one thing where we will see large like adoption and usefulness of AI is in the patient management side of things. So wherein it could be report generation, it could be understanding the history of the patient, where AI could quickly look at the medical reports at a very fast pace and try to generate summaries, and not just one patient, but you can also do like a summary generation from multiple patients in the entire hospital. So that is on the patient management side of things. In diagnosis, I think, which we will talk more about in today's episode, is also making significant strides, and I'm sure we will delve into more details later on. And the other areas in the biotech in the drug discovery space, where you have to understand the proteins and the drug synthesis, and AI sort of like allows you to simulate it at a much faster pace, which brings down the cost of development of a drug, but also like get to that successful drug much quicker with faster accuracy.
Yeah, yeah, that's really powerful, like the way you explained it, because especially like the idea of like how AI, it really isn't just about like providing something with speed or efficiency, but actually about like helping doctors make better decisions for the patients, because I mean, as a patient, right, it's reassuring, to like hear that AI can support things like, earlier detection and more like personalized care rather than just like replacing the human judgment. And
Yeah.
like one more thing, like just like a different like area. I just want to say like how these tools can just like reduce uncertainty and catch things that might just be missed by the human that might just be missed by the normal human eye, and it makes like the future of healthcare like feel more proactive uh instead of just being reactive. And hearing this like also just makes AI feel much more personal because this impact is gonna like
Absolutely.
affect us when
Yeah.
we go and become patients.
Yeah.
So that was like really amazing. And now you mentioned AI diagnostics, so I just had a question on that actually. You specialize in explainability and trust in AI diagnostics, and it's a term that like sounds complex but exciting. So can you just break down what AI diagnostic actually means and like explain how your work in explainability helps build trust for AI diagnostics?
Sure. So again, to our general audience, like diagnosis is it's all about decision making, right? So you diagnose a patient for a particular type of cancer or other diseases. So when it comes to cancer, it could be like either normal, which is no cancer, or different stages and grades. So it's all about decision making at the end of the day. Now, a pathologist who usually does the diagnosis comes to this by looking at a tissue specimen under a microscope. Now, just imagine that you have digitized this tissue specimen, and now you look at it on like big screens or on a laptop, and now there are AI tools which understands these images. It's a classic computer vision problem. So, you have AI algorithms that tries to understand these images and try to mimic what the pathologist eyes try to see. So, when you talk about the adoption of AI or like developing AI for the field of diagnosis, now the algorithm itself could look at like deep layers within the image, which might not make biological sense. So it's very important to understand the biology that drives the development of AI. It shouldn't be the other way around. So what I mean is you cannot have like a deep learning framework and you just pass on labels to those images and it comes with certain accuracy, but you miss out on the biology. So the explainability that I always talk about is that even while building the AI from scratch, you need to incorporate the medical literature, like how the diagnosis has been done for decades, if not generations. So there should be some aspect of that that has to be inculcated within your Gen AI framework or your image segmentation or identification. So that allows you to sort of interact with the domain expert, which is the pathologist, right? So they might detect like certain features within an image. Your AI has to follow that particular route and try to. That's like the bare minimum that you do. That is, you should at least detect those features and then tell me something which the doctors have never seen. Uh, and that allows you to build the framework which could actually be used by the clinicians than raising like big eyebrows or big doubt on what this AI is doing and why should I use it.
Yeah, and I think like another like way to say it is like it shows that like trust isn't automatic, but it has to be designed into the system. And uh yeah, like the part about like doctors needing to understand why an AI system reaches inclusion is and not just what the result is actually really important. And it makes a lot of sense because that trust like it comes from transparency, especially in healthcare where decisions are really important. If you make a wrong decision, you like that could mess up like a person's life. And
Yeah,
hearing how AI like supports doctors rather than actually replacing them helps like clear up a lot of the misconceptions that people uh people might be thinking. And that idea like that idea that explainable AI can actually strengthen clinical confidence is really interesting. So this leads to my next question. You mentioned a little about pathology, and
yeah.
I just had like a question. So AI is also like beginning to shape fields like pathology and precision medicine, which aims to tailor treatments to individual patients. So, looking ahead in the future, how do you see AI changing the way doctors diagnose illnesses or personalize treatment over the next 5 years?
Sure. Again, a great question, and thanks to that. First thing is, again, taking a step back, the US is facing a shortage of pathologists, and this gap is by some of the estimates, it's the gap is going to increase in the next 5-10 years. So, first thing is like digitization of the physical glass slides is going to play a big part, and that is the first approach towards adopting AI. Because if your tissue is not digital, you cannot run any AI algorithm on that. So more and more labs are going digital, and it's getting a lot more popularity. And once you go digital, AI is sort of like, helping doctors right now in doing some of the routine tasks, which takes a lot of time. Like, for example, counting cells within an image. Now, that's one process which takes a lot of time for a human eyes to do that, and there's a very high chance of missing out on the cell type or counting, right? So AI comes in with great performance to do like good cell segmentation and do the quantification, give the report, whereas the pathologist could focus more on the macro regions within the tissue, like where there is tumor, where there are like necrosis and all these like high level features within the tissue. So again, I would say AI plus pathologist is bound to revolutionize the way we look at diagnosis, with fewer patients being misdiagnosed. That will in turn lead to the right treatment for these patients who are previously misdiagnosed. When it comes to precision medicine, now just imagine you have all these like slides digitized, you have the metadata associated with it, you have run your AI algorithms from several different several different companies or partners or algorithms on that. That will allow you to maybe create like a data bank within your hospital that allows you to do like a image similarity search. Like say 4 years down the line, a new patient comes in with a unique case. Now I could quickly run like an image similarity for this particular patient, and AI will very quickly tell me, okay, this particular image looks like all these images from the previous years, and this was the pathology report. Now you could quickly assess and use some of the findings from those previous reports, because you would have tracked the performance of the patient for the 5 years, right? Who had come 5 years back, and now say the patient is all healthy. So that was a correct diagnosis and correct treatment. So I think that has the biggest impact to play with digitization, using AI, because you could run like a massive image similarity search and look at the previous cases and just speed up your process.
Yeah, the future, like, it sounds like really exciting to see,
Yeah,
especially because like the shift towards like more personalized and like you said, data-driven treatment
yeah,
decisions. And like what stood out to me is most of like how AI can help doctors see patterns across massive amounts of data that would be usually like impossible for someone for a group, even for a group of people to analyze manually. And that's
yeah,
exciting because it means like better outcomes and fewer trial and error approaches. Like, and it really highlights how AI can help how AI can make medicine both more precise and more human for a person. So a lot of people hear about AI in healthcare and immediately think it's like, it's like way too futuristic or honestly a little scary. So
mhm.
from your experience working so closely with doctors and researchers, what's one misconception about AI in healthcare that you wish more people would be more aware of or understand?
Sure. And I think this might have been heard like hundreds of times outside, which is like AI trying to replace pathologist, and that's not true at all. And that's like one misconception, where AI is not meant to replace pathologist, but replace the pathologist who don't use AI. So I think that's a large misconception. So the other misconception is that, like, say, everybody has heard this so many times. Like, if I have to bring in another misconception, which is people sort of like try to think, okay, did we like crack the AI for diagnosing cancer? Now cancer itself is like so complicated. Like, we have so many different organs, different stages of cancer, and the morphology of the tissue is so different. So AI being able to identify and to detect all the cancer types, I think it's a very premature statement to say.
Yeah.
And even now, right, like, one AI doesn't do a good job if it was not scanned on a particular scanner, because it was trained on certain protocols and certain scanners. So it's like the AI is in its own comfort zone, I would say, like, on the scanner on which the data was produced, and the pathologist who annotated the data. Now, immediately, if you take the AI to outside the facility or to a different country, for example, say the AI was developed in US, but it is being deployed in India, things don't go very wrong. So I think one misconception is like uh, on either ends of the spectrum, wherein don't go digital, still sees light under the microscope, which is zero, to
Yeah.
one, which is like AI doing like all types of detection. So I think both ends of the spectrum has its own like limitations and bottlenecks. I would say we are like very early on, like taking baby steps where AI is helping, like the clinicians doing those tasks which takes them a lot of time. That's one thing, and that like that facilitates like a soft adoption to the pathologist, because at the end of the day, if they are not ready to use it, then we cannot see an adoption and a good amount of use cases. So I would say we are taking small steps, but I think this will eventually, like we will see the impact happening for the accuracy in diagnosis as we move on.
Yeah, and I think that does actually clear up a lot like of the misconceptions. I think like, most people like especially patients like they don't actually realize how much AI is meant to support doctors instead of replacing them. And like hearing that these tools are like, designed to improve accuracy, it makes
Yeah,
like it makes the whole idea feel it makes like the mo it feels sorry, it makes the whole idea feel much less intimidating. And like this perspective like really just helps bridge the gap between like what people imagine AI is doing compared to like what is actually happening in hospitals today. And I just had one final question before we end our discussion. So speaking about like what is happening in hospitals today, my question for you is what's the biggest gap right now between AI research and real clinical adoption?
sure. So again, thanks for the question. And I think sometimes what happens is the AI research and the clinical systems are disconnected, or there's a disconnect between the experts and the AI researchers, not just in healthcare, it could be like any field. So, what I believe is, as an AI researcher, and I did that during my PhD as well, which is trying to sit with the pathologist, trying to read the medical literature, so as to spend equal amounts of time in reading the medical literature as I was trying to spend time in reading like your ICML, ICCV, or MICAI publications where they talk about AI methodology. So I think that's like so important, and many researchers miss out on that. They spend like 90 to 95% of the time in trying to make a GitHub code work, or try to read like latest architectures, or like what's out there, the performances and methods and all that, and they just try to deploy it on the medical imaging data. But what I would say is that like spend at least like 40 to 45% of your time in sitting down, understanding the domain a little bit, see how an expert has been doing it for these many years. Now, what are the features they pay attention to? What are the features that they usually miss? Now, these are the action items which the AI has to address. Otherwise, there is no point in building that AI system. Like, to give you a very small example, right? Uh, Cancerous like tumor is very easy to detect on the tissue. Now there are so many companies out there who still have like algorithms for detecting tumor. But sure, like it's fine. It's a nice tool, but will a pathologist use it? Probably. But would they want to use it? I don't think so. Because where they need more help in is in trying to detect subtle features where there's so much of confusion, which is the origin of disagreement or discordance. So I think there is this disconnect between AI researchers and the experts, and I think there should be much more stronger collaboration. And you should use the experts not just for annotating your data, but also to help you understand that data which they annotated. So
Yeah, that makes a lot of sense. Like especially the gap between like what works in research settings and like what could actually be used in real hospitals. And I think
yeah,
that perspective, it really highlights why collaboration between researchers and clinicians and like people in clinics and product teams matter so much. And it definitely like changed how I think about like what it takes for AI to move on from like the lab to like real patient care, that transformation. So thank you very much for the answer, and thank you very much for joining with me today. This will be the end of our episode. Akash, thank you very much for joining. I learned a lot from this conversation, like, especially about how AI in healthcare isn't just about, advanced algorithms but it is instead about improving trust, accuracy, and patient outcomes. And hearing how AI can help doctors um detect diseases earlier and personalize treatment. Like, it really changed the way I think about the future of medicine or the future of healthcare. And this discussion made it clear that AI is built responsibly. It can make healthcare more precise, more human, and more impactful. And I really appreciate you taking the time to share your insights. So thank you very much.
No, thank you so much, Veer, and thank you for those questions. It was very interesting, and some of them are like important questions. And again, if anybody wants to reach out to me, I could leave my LinkedIn handle in the comment section or description, or you could also reach out via email. And yeah, it was a great episode. Thank you so much.
Thank you.